welcome back to my channel. My name is Chloe if you are new here, and if you are, I would love for you to hit that bright red subscribe button down below. And of course, if you enjoyed the video, don't forget to give it a big thumbs up. So today I have got for you another nursing video, and as always it is sponsored by the lovely people over at Nurses.co.uk, who will be linked down below as they always are. And today I thought I would give you some advice about placements. For anyone who doesn't know, I have literally just graduated as a mental health nurse, but I know, 3 years ago when I was starting my training, I think the thing that was scaring me most was definitely the placements, because I went into this straight out of school, so I had no experience whatsoever. So the thought of going on a placement was terrifying. This is a part 2 to my student nurse survival guide video. I will link it up there if you haven't seen the first part, but that one is all about kind of the academic side of things, and today we're talking about the placements. Now, when you'll go on placement will vary from university to university, and even within your cohort, because my university split the nursing groups up into 2, so I was in group 1, so I went on placement first, but then group 2 didn't go on placement until 6 weeks after I did. But because I was in group 1, I went on my first ever placement 6 weeks after I started my course. So I had 6 weeks at university, and then I went straight out onto a ward. And I remember thinking, I'm not ready for this. What are they doing? I'm definitely not ready for this. But clearly, as I'm sat here 3 years later as a qualified nurse, it all turned out fine, and that is the important thing. Depending on your university, you will usually find out where your placement is a couple of weeks before you actually start the placement. And my first piece of advice is, at this point, start doing some research. If you are going into, as I said, I'm a mental health nurse, maybe you're going into a CAMS community team, do some research. What do community mental health teams do? What do CAMS community mental health teams do? What kind of things can you expect to see? Or if you're going on to, I don't know, a dialysis ward, research dialysis. How does it work? Make sure you really thoroughly understand the kidneys. Just make sure you've got a good basis of knowledge, so that when you walk onto that ward on the first day, it's not quite as terrifying, because you kind of have a rough idea of what's going on. And this is where Nurses.co.uk can really help you guys out, because they have got loads of fab resources and blog posts on their website. So it's well worth reading some of those just to help you get better prepared, because they're all written by nurses, so it's going to give you a really great perspective of what it's like to be working as a nurse in that environment or in that situation that the person's talking about. The next thing you should do after you've done a little bit of research is make contact. Normally you'll be given an email address or a phone number for the ward or the team that you're going on placement with. And my advice is just to drop them an email or phone them if you're feeling very brave, and just say, hi, I'm Chloe. I'm going to be starting placement with you guys on such and such a date. I just wanted to find out, is there anything in particular I need to know before I start? Is there anything you'd recommend I research? That kind of thing. Just introduce yourself and show that you are keen, because then they're going to have a great impression of you before you've even arrived. Another good thing to do is ask if you could visit. Now, some places might say no because it's really difficult or it's not possible, but I went to visit most of my placements before I started there, and I just found it really reassuring to kind of know that on my first day I would kind of know who I was looking for, I would know where I was going, I would recognize some familiar faces, and again, just have a better idea of what to expect, which is really going to help with those nerves. Another really important thing to do before you go on any placements is to familiarize yourself with the NMC code, the Nursing and Midwifery Code. If you're a new student nurse or a prospective student nurse that hasn't looked at this yet, do it now. I cannot emphasize how important the NMC code will be to you as a student and throughout your entire nursing career. It's basically a code that outlines the expected behaviors and commitments of a nurse. And it's a really good thing just to have in the back of your mind all the way throughout your training and when you're a qualified nurse. It's also a really great thing to include in every single one of your essays. There will not be a single essay that you write where you cannot include and reference the NMC code of conduct. I will tell you that now. And it should get you some extra marks, because it will show the lecturer that you can link your academic work to your practice, which is obviously a very important feature of being a nurse and training to be a nurse. When you actually start the placement, carry a notepad and a pen with you everywhere, all the time. I mean, you should have a pen anyway, because nurses always need pens and doctors never carry them, so it's always worth having a few pens handy anyway. But the great thing about having a notepad handy is it means if somebody mentions something or you see something written down that you don't really know what it is, but now isn't a good time to ask or to research it, jot it down in your notebook, and then when you've got a spare 5 minutes, or 5 minutes that's a little bit less hectic, you can ask one of the nurses you're working with or research it, depending on what it is. But if you're not jotting them down, it's so easy to miss these things because you think, oh, I wonder what that medication is, and then something else happens and you just completely forget about it, and then you get to the end of your placement and you never remember to sort of go back and find out what it is that medication does, for example. Or somebody might use a really complex medical term that you've never heard of before. You know, there's going to be so many things that you're going to come across that you've never heard of, never seen. So just jot them down, and then when you've got some time, you can properly look into it and understand it. Along the same kind of lines, acronyms. So for some reason in the health service, we seem to love our acronyms. I could probably list off for you about 100 right now, but I know when I first started, I hated acronyms because there were just so many, and sometimes it didn't even make sense to have an acronym because it was already quite a short word. But you're bound to get confused by acronyms. They do kind of take quite a long time to sink into your brain sometimes, so it's well worth just keeping a little list in your notepad so that every time you see it and you just think, oh, I can't quite remember what that one is, you've got a list in your notebook that you can refer back to. A couple of acronyms that I can think of off the top of my head are like medications. So when a doctor prescribes a medication, they will obviously write the medication, the dosage, and then they will write how many times a day they want that medication to be given. So you've got OD, which stands for once daily, BD, which stands for twice daily, TD, which stands for 3 times daily, and QD, which stands for 4 times daily. And sitting here now, you probably think, oh yeah, that's really obvious, I'll remember that. But let me tell you, when the ward's really hectic and there's a manager on the phone shouting about something or other, and there's a relative that needs to speak to someone, and there's an incident going on and you're trying to do medication, it's so easy for little things like that to go out of your mind. So at least if you've got it jotted down in your pocket in a notepad, then you can just quickly refer back to it and you're good to go. Along a similar kind of lines, make sure you are asking questions. If you don't know what something is, if you don't know what something means, just ask. 99% of times, people are going to be more than happy to explain something to you or tell you what it is. You know, you might get 1 or 2 members of staff that are a little bit funny about it, but you will eventually learn who those people are and not bother to ask them any more questions. But those people are very few and far between. Most people want to help you learn and want to help you grow as a nurse. So they are going to be more than happy to answer your questions. But just think about the time and place. You know, if there's a major incident going on, now is not the time to be asking what that drug is. Again, jot it down in your notebook and ask when the incident is over. Another really important thing to do when you are a student nurse is spend as much time as you possibly can with the patients. And this might seem ridiculous, but it's so easy to get caught up doing paperwork, which, don't get me wrong, is really important, but you have got the rest of your nursing career to do paperwork. And that's quite an easy thing to learn how to do. You know, once you've done a handful of risk assessments, you're going to be competent at that skill. But things like communication and how you relate to patients and, you know, dealing with maybe somebody that's quite upset, those are skills that you are just going to keep developing and developing. So whilst you aren't tied down with the responsibilities of being a qualified nurse, make the most of it and spend every spare minute of your time with the patients. If you're just sat in the nursing office not doing much, then people are going to think you're a bit lazy. But if you're sat in the communal areas chatting with a patient, nobody's going to think you're being lazy. They're going to think you're developing your skills. If you are asked to do something that you don't know how to do, say so. One of the most important things about being a qualified nurse is knowing what you can and can't do, what you're competent to do, because that's what the NMC expect of us. They expect us to do what we are competent to do. So if you don't know how to do something, say so. There's a right and a wrong way of doing it though. Don't just turn around to your mentor and be like, I'm not doing that, but simply say to them, I'm really sorry, but I've never done that before. I don't know how to do it. Can you do it with me, or can I watch you do it once and then I'll try it afterwards? You know, especially if it's something to do with patient care. For example, I don't know, giving an injection. If you've never even seen an injection before, then don't do it just because your mentor said you can do it. Make sure you watch it a few times first, you understand the technique, and you feel confident enough to give it a go. The nurses you're working with will respect you for knowing your limits and only doing what you are competent to do. Even as a qualified nurse now, I wouldn't dream of doing something I'd never done before. For example, if somebody asked me to put an IV in, that isn't a skill that you learn as a mental health nurse, so I wouldn't be able to do it. Not without somebody showing me first. Another really important thing is to make sure you report any issues. If you see something that you're not comfortable with, if another member of staff is bullying you, if you're just not sure, report it to somebody. Do not have all that weight and responsibility on your shoulders. Hand it to somebody else. Speak to your mentor, speak to the ward manager, speak to your university. Just make sure that you're not the one holding on to information. You should always make sure that somebody else knows what's going on. Another thing that I would really recommend while you are a student student is to spend some time with other professionals. Whether you're working in a ward or a community team, the vast majority of time you'll be working in what are called MDTs, multidisciplinary teams. So that means you'll have nurses, you'll have care assistants, you'll have doctors, consultants, maybe psychologists, maybe physiotherapists, maybe occupational therapists. There are going to be so many people working within close proximity to you that as a student is the best time to get to understand their roles better. And it's really important as a nurse to know what our colleagues do, because then we can make appropriate referrals. So if you see a patient that, I don't know, maybe struggles with tasks like preparing food or cleaning their home, because you've spent some time with an occupational therapist, you would know that they are the best person to help this patient, so you can refer them on to that team. As a qualified nurse, you are not going to get the opportunity to sort of dip in and out and go and see what other people are doing. So make the most of it when you're a student. You know, whether that be spending a day shadowing the doctors or attending an assessment with a physiotherapist. If you ask your mentor and explain to them why you're interested in that, then in my experience, they're going to have no issue with you going along and seeing what other people do. It's also really great to ask your mentor what learning opportunities are available, because I don't know, if you're in a certain ward, there might be the opportunity to go and observe in theatre, or there might be a community team sort of closely attached to the ward that you're working on, and students might be able to go out and spend some time with the community team as well to get a really well-rounding experience. In my case, I had a CAMS community placement, and I got to do some training that allowed me to do ADHD assessments. So basically that meant that I went into schools to assess children that had been referred for ADHD assessments. So I went into schools and then I had to write a report about that child afterward, talking about whether or not they met the key criteria for ADHD. And that is something that never would have happened if I hadn't have asked, is there anything else I can do? Are there any other learning opportunities? So that was a really cool thing that I got to do all by myself. I was completely independent. I went to these schools on my own, wrote the reports and submitted them to the psychiatrist that was dealing with the child's ADHD referral. So it was really empowering as a student to be trusted and to be able to go and do something on my own. And I never would have got the opportunity if I hadn't have asked. Another really, really important thing as a student is to start getting into good habits right from the get-go. And by good habits, I mean things like taking breaks, eating and drinking well when you're on shift, sharing the workload, you know, things that seem really obvious but often get forgotten. And I think if you get into the habit of doing that while you're a student nurse, you will then hopefully continue that throughout your practice. You know, there are going to be days when, I don't know, you're really short-staffed or there's, you know, a major incident going on that's going to affect that. But if you go out of your way to try and take care of yourself during your shifts, it's going to make your life a lot easier, and then those good habits will hopefully follow you throughout your nursing career. It's also really good to be aware that sometimes you're going to have placements that you don't enjoy or in areas that you would never want to work in. However, go into them with an open mind. Just because you don't want to work in that field doesn't mean you aren't going to learn something. The best example of this for me was my older adults placement. So I had a placement on a dementia ward. I was there for 3 months, and I remember when I found out I was going to be there, I was like, oh, really? Not because I don't love older people, I do, but that just wasn't the area of mental health that I wanted to go in at all. So when I found out I was going to be there for 3 months, I was kind of a bit like, oh, I wasn't too excited about it. However, it was by far one of my best placements, and definitely the one that I learned the most in. There are so many skills that I picked up through working with older adults, you know, from personal care. I learned so much about physical health. I got to spend so much time just sitting and talking to people. Like, it was by far my best learning experience, even though I have absolutely no intention of working in dementia care. So just make sure, no matter what the placement is, go into it with an open mind, because you are always going to learn. Even if you want to work in, I don't know, say A&E, and you get a placement on a neuro ward and you're a bit like, oh, you know, I don't really want to do this, I'm not interested in this at all. There's a good chance that working in A&E, you might see neuro patients, or you're going to have people coming in with neuro injuries. So no matter what, you are always going to learn and you are always going to develop new skills. So just be aware that even if it isn't an area you want to work in, that doesn't mean you aren't going to learn something valuable. And also, I've met a lot of people that have changed their minds, where they've been so determined, you know, I'm going to work in this area when I qualify, and then they had an amazing placement in a completely different area, and then they've ended up working in that area. But if you'd have asked them before they started their training, they would have said, nope, no way, I would never work there. So keep your mind open and keep your options open. And then my very final piece of advice is, being on placement It's stressful. I'm not gonna lie to you, it is very stressful. You are often gonna have times when you're on placement, but you've also got assignments to do and exams to prepare for. And if you're like me, you might have to work on top of your placements to be able to afford your rent. It is gonna be stressful. So make sure you look after yourself. Make sure you have downtime. You are not a robot. You are a human being and you need to look after yourself. Make sure you're sleeping well, eating well, exercising, doing things that you enjoy. Don't allow yourself to burn out before you've even started your career, because a burnt out nurse is no good to anyone. So make sure you take care of yourself. As I said, I really hope you guys found this video helpful. I have got a whole load of nursing videos here on my channel, so I will link the playlist down below if you want to check them out. Don't forget to give it a big thumbs up and subscribe if you haven't already, and I will see you again next time.